It's great to be here at Aspen Ideas Health with CDC Director Mandy Cohen. We're going to talk today about the critical role of public health and its impact on the economy. So Mandy, let's get started. Let's talk about the relationship between public health and business. And why is this collaboration so important to the public health community?
Well, first, Judy, thank you so much for the collaboration between the CDC and the CDC Foundation. You help us fulfill our mission to protect health and improve lives every day, so thank you. And we know that in order to meet the mission that we are both working towards, this has to be a team sport. It's a big mission to protect health and improve lives, and it takes all of us. And I think we saw during the pandemic that happen, right, where we were all facing this virus together, and I saw the collaboration with the private sector in an incredible way where I really hadn't seen it before. I saw hospital systems that are usually competitors come together and say, how do we solve problems? I saw our private sector businesses in North Carolina say, how can we change our manufacturing lines to help here? How do we help you with logistics so we can get vaccines out faster? Amazing kinds of partnerships. Thinking about the tests that we had to develop, the therapeutics and the vaccines. So incredible healthcare partnerships. But what was awesome was that partnerships even with the private sector. I remember some partnerships with our chambers of commerce, small businesses, large businesses. And that is what I'm hoping we can sustain as we've moved out of the emergency, which is great. But we are in this phase where we need to make sure we are continuing to protect health and improve lives, even outside of an emergency. And I'm starting to see people kind of go back to their silos, to their corners, but the threats are still here to our health. And we all still have such an important role to play in that. And so the business community is so vital to us being able to protect health of every community in this country.
Yeah, I love the team sport. We need to keep the team together.
That's right. That's right.
So when public health officials engage with for-profit businesses, what are the opportunities and what are the challenges?
Yeah, so I think there's a lot of opportunities when you think about public health working with healthcare private businesses. And then I want to come back to other businesses that are not in the healthcare space. But in the health delivery space, we have so much partnership already that is ongoing, and I want to make sure we continue to stay aligned. Whether that's partnering with primary care doctors, to hospitals, to pharmacies, the alignment there to protect health is so important. Just think about vaccinations, right? We know that the vaccines are so important to save lives, but we in public health, right, are working with manufacturers to develop them. We make recommendations, but often folks are going to their pharmacy or to their primary care doctor, their pediatrician to get those vaccines. So we have to operate as one team to get folks vaccinated. So I think that's a really great place where I've seen ongoing collaboration, but we need to do even more. But then think about for all of those businesses that are not healthcare businesses. Maybe they're retail businesses, they're in hospitality. I think we've saw everyone who was in an airline business and hospitality, that their businesses can get turned upside down by a virus if we're not prepared and not ready. And so thinking about making public health part of their own advocacy agenda is so important, right? I want businesses to make sure that amongst the many things that you need from the government, make sure you're advocating for investment in public health, because that investment is going to be good for your business. Strong public health is good for business. So that's a big message. I hope businesses hear from us and don't forget about the coming out of the pandemic, that strong public health is good for business. But then there's also things they can do every day right now. Businesses can do to protect health and improve lives of their own employees. And again, good for business. Businesses want productive employees, right? Of course, we all want a healthy, effective workforce. And there are ways in which what CDC is doing and what we're learning can directly impact and improve the lives of your workforce. And so vaccines, again, I'll go back to that, are an important one, particularly as we think about COVID and flu that's going to come around every year that we need to make sure we're protecting ourselves against. But it's even thinking about mental health, right? And how do we protect our workforce and their mental health challenges? I think employers have a huge role to play. That's where we spend a lot of our time, is at work. And how do we think about mental health where we work, live, and play?
Yeah, awesome. So let's dive a little deeper into examples. Can you give some examples that you've seen showing these successful models of business and public health working together with or without funding.
Yeah. So one of the great things that I've seen as a public health director is when some of our healthcare entities and public health work together, and we have to be one team. I've often seen health delivery side and public health siloed, but the pandemic brought us together, and we need to make sure we stay together. One great example is around our laboratories. We know that making sure we have the right test to detect health threats, whether that's COVID or something more recent like Mpox, and now we're thinking about avian flu. We need to make sure our labs can detect those diseases. And one partnership we've done recently, a formal partnership, was when CDC was able to transfer the test that we had developed. So, right, we used our expertise, but we're able to give that over to our commercial labs, and they do what they do best, which is scale up. Right, so we use our expertise to do the initial development. They do their part, which is to scale up to national scale. And we each play our role, but we're able to use that formal relationship. Wonderful outcome, which means tests available for everyone, which is great, and access. But that doesn't have to be the only way we work together. I think having conversations about where do we play different roles, and even if there's not a formal relationship, how do we solve problems in alignment together? I'm thinking about big health systems or networks of primary care doctors who are trying to keep their communities healthy. That's what public health is trying to do as well. And as we have conversations to say, what can we tackle together as a community? I was just in Northwest Arkansas, and they have decided as a community they really want to tackle maternal mortality. I love that because they unfortunately have very high maternal mortality in Northwest Arkansas. But they brought everyone together, not just healthcare and public health, but the education system, academia, government officials, thinking about how do we think about this hard problem together as one community. No money exchange, but alignment, right? And to say, we're having a problem here as a community, but we know how to solve it together. But I love that they had the business community because look, young moms are working. They're working moms, and their employers need to be part of that solution as well.
Yeah, no, it's great. So I'd love to get your thoughts on how we normalize these successful partnerships and models of cross-collaboration.
Well, one, I think we got to be better at storytelling. So first, great to be telling some stories here today, but I'm hopeful that as we partner with CDC Foundation and others, that we can continue to tell stories of these successes and make sure that the businesses themselves are telling them. Because I know they're seeing the value because they tell us, but hopefully that they can tell some of those success stories together as we're bringing these collaborations together. So I think that's an area where we can work together.
Yeah, for sure. So let's think about innovation for a minute. We've talked a lot about the partnerships. Are there specific areas that business partners can partner now with public health to push innovation?
Yeah, so certainly on the health delivery side, we need to continue to innovate around advanced diagnostics, right, to make sure that we're detecting new threats that are out there, new therapeutics. We have, we know that we are seeing antimicrobial resistance, meaning that our antibiotics aren't working as well as they used to, and we need to make sure we're still innovating. So those are key areas where it's not just CDC, but it's the private sector, it's NIH, it's all of us together working on therapeutics and diagnostics and innovation. But then there are ways, for example, like the new way we detect signals through wastewater. A lot of that innovations come with a private-public partnership through that. So we want to see wastewater and what it can evolve and grow into. I think that's an exciting partnership in the future that I'm looking forward to building out.
Yeah, I'm quite excited about the wastewater surveillance. It really is, what a breakthrough.
Right, and again, a place where a crisis like COVID started that innovation, but now we've mapped it to Mpox and avian flu, and I'm excited to think about how that can be a tool. But again, a perfect private partnership here where there's innovation both in academia and the private sector and at CDC, and we're all stronger together.
Yeah. So you've talked about what business can do for public health. I mean, certainly it's a big payoff, right? So we need them advocating for public health. Any other thoughts on what business can do for public health?
Yeah, so I know when businesses are thinking about their agenda of what they're going to advocate for their business, I'm hoping they're remembering some of the lessons of COVID. One, that if we don't have a strong public health system, it can be a big impact on their business in a negative way. And so I hope they see, just like having a strong military that we have for our country, having a strong public health system to protect us is absolutely vital, right? So they advocate to make sure that we are safe at home from a military or a police standpoint. Well, same is true for both a national defense at the CDC level, and as well as local and state public health. I don't want businesses to forget advocating for both what's happening at the federal level and in their backyard at the state and local level. I also want businesses to remember that when CDC is well funded, it actually 80% of our dollars go out to state and local communities. And so when you hear us say we want a well-funded CDC, that is about a well-funded community infrastructure that is directly helping their business. So I think that is absolutely important. But then also, how can they advocate for a healthy workforce? And what are the really strong things that they can do around mental health, around their insurance design, about incentivizing the healthy behaviors that we know work, like quitting smoking and making sure that we're getting our vaccines. So those are the ways in which I think businesses right now, today, can be helpful to protect health and improve lives and be on team health.
Yep, team health. And your point about the funding from CDC going out to state and locals, a lot of people don't realize that.
I think that's right.
They have no idea.
I think they think all that money stays at the national level, but it is our job to get that to communities, because we know they are the tip of the spear of where threats are happening, but also where the work to respond is happening. And we see that happening right now as we respond to an outbreak of avian flu in our dairy cattle for the first time. So we are making sure that our state and local partners are well resourced to be able to respond to that work, and of course mobilizing as many dollars as we can to support their work and ours as well, to make sure we have a national response that is appropriate.
So let's pivot to data. As public health leaders, we talk a lot about having on-demand, real-time data. Super important. We understand why it's important to manage both the economic and the social impact of public health challenges. So how do we build upon the sharing of data to more proactively address health threats, ranging all the way from diabetes to dengue to avian influenza that you just mentioned, to rural health issues?
Well, we know that data is the oxygen that powers our work to be able to stop health threats. Because you can't stop a threat you don't see, right? So you need that data to have the visibility to say, uh-oh, we gotta get in there and respond. And we have to recognize that data lives in a lot of different places, and we have to figure out a way to bring that data together in a way that protects privacy, but allows for that visibility to respond quickly. And so we have a lot of work underway to make that happen, and a lot of really good progress, but we need to continue to make progress there. A lot of that progress has been voluntary, and there are a lot of volunteers raising their hand, which I'm real appreciative of. But I do think there's more that we need to make sure we have the resources. This is hard work. So we have to modernize systems, and that takes money and talent. And then we need the right authorities to make sure that that data can flow. Because folks are collecting that data, but often it sits in a silo, maybe because of the technology pipes are not there, but also because there's competitive advantage to holding on to that data. And so we need to make sure that that data can continue to flow. So we're trying to set the standards for that, protect privacy as we are moving forward.
Yeah, that's great. So when you think about investing in public health, what's top of your list? I think folks would love to hear that. And what's the role for the business community in that investment?
Well, I think there are a lot of health threats that are out there, so we have to prioritize, and that's what data also gives us. And I think any business leader out there knows that good data is how you prioritize. And so when I look at the landscape of what are the things that I think are important to invest in, we have three priorities at CDC. The first is to be ready for any health threat, as we've been talking about. And to do that, you need data systems, laboratory systems, talented workforce, response capabilities to be ready no matter what, right? Whether that's something related to extreme heat or an infectious disease, we have to be ready. So that's one that I would love for businesses to say, you know what, just like the military, we need to invest in that critical infrastructure to be able to respond. But then second, and I'm sure businesses are seeing this in their workforce, one is that we have strains in our mental health. We really need to be investing in our mental health infrastructure. Again, we're losing 100,000 folks to overdose and 50,000 to suicides. And right, those are younger folks, right, that are dying too soon. Often these are folks who are fully employed. And so how do we think about engaging the business community in making sure their own employees have the mental health resources they need? So that's a second. And then the third is about supporting families, and again, particularly working families. There is so much that businesses can do right now to make sure they're supporting families and their health. They want a healthy workforce. We have great data and expertise to say, here are the things that work. Here are the things that might not work as well. Don't just check the box with a wellness program out there. Make sure you're getting the best evidence of what wellness programs work. What are the things that actually drive folks to stop smoking, to prevent diabetes, to make sure folks are vaccinated. We have evidence and data on that from the CDC, so we can be a great partner here to you as you're thinking about a healthy workforce.
Yeah. So in closing, my question for you is, we're here at Aspen Ideas Health. What's been a highlight for you?
Well, it's so wonderful to be here at Aspen. I mean, look at this setting. It is both an opportunity to connect with leaders from all over the country and really the world and different walks of life. But it's a time to also connect and think, right? And yes. These are the big ideas that we want to push forward and make sure we're doing, and really to think about deeper partnership together. So it's really been an important moment to take some time to reflect, also to build relationships and think about deeper partnership. Again, grateful to the CDC Foundation for always thinking about partnership and helping us fulfill our mission to protect health and improve lives. But it's been a great few days here in Aspen Ideas and a lot of work to do when we get home.
Yeah. Well, so Mandy, thank you for your leadership and for your great communication. I'm going to do a shout out. Time 100 recognized you for your communication, and I think it's very well deserved. So congratulations, and thanks for joining in this conversation here at Aspen Ideas Health to talk about innovation and what businesses can do to help support public health.